Hello, I'm Dr. Caroline West. I'm a GP and I'm here this weekend in Narrabri for the Health and Wellbeing Weekend with health professionals. Now, as health professionals, we really should be amongst the healthiest people on the planet. After all, we have access to knowledge, experience, expertise. We spend so much of our lives looking after the health of others. But the big question is, what do we do when it comes to ourselves?
We are seeing the barriers of the stigma of mental health still within health professionals, in terms of that I should be stronger. I'm in the role of being a mental health a medical professional, that I should be able to look after myself, I should be able to care for myself, I should be able to manage this myself. Perhaps there's a weakness there. What if I do share this with someone? Am I going to be reported? Will it get back to the community that I'm not working at capacity because I am struggling with that? So they're some of the barriers that we do see.
Often people forget that they're actually real people. So I think it's great that we're sort of doing something for the needs of the actual doctors and also the patients.
Doctors really are just like everybody else in the general population. Yes, we have a lot of stress in our workplace, but given the right situation, it's very easy to get help, and it's very important to recognise that you need to be able to talk to people.
I think that our colleagues need to realise that help is out there if they need it. They shouldn't be sort of worried about the implications or the judgment or the fear around admitting that there's an issue with mental health, or that they need some help, or that they need to put well-being first and foremost. And if we can shift our sort of thought pattern around that, we're going to be much healthier as a professional and be able to help our patients even better.
Generally, as healthcare providers, I think we have very high expectations of ourselves. In some areas, certainly, there's a lot of external expectations as well. For me personally, so living in a very small rural town, it's very tricky to set those boundaries in place between personal relationships with people and work relationships with people, and being their doctor, as well as their, colleague, or their, co-mum, or, tuck shop co-parent, or whatever else.
We're really bringing the education to the area rather than the doctors and other clinicians having to travel elsewhere. It's important because the rural areas have less resources, so less access to education and less access to networking with other GPs. And by holding this in Narrabri, it's allowed those people to come together.
The associated costs with leaving your home just to travel anywhere, it's normally a day's plane flight, and accommodation, disruption with your your work practices, and you feel guilty sometimes because you don't want to look after yourself and learn because you've got clients that you feel you need to value them more than yourself. So this is amazing to have PHN and the Rural Doctors Network come to us.
There's two things, I suppose, that I get out of this weekend. One is the fact that it is in a rural setting means that you feel valued as a rural practitioner, and that's this event is brought to you close to my hometown is important. And the other thing is the connection. Like, the talks are fantastic, but there's only so much you get out of talking. The big thing is the connecting with the other participants and the presenters about mental health, and forming those connections, building those networks.
The networking is really important, particularly as I'm a private practitioner, so I'm not in a hospital setting where I'm going to journal clubs and that sort of thing. So professional development is very important.
We're starting to see some real traction around looking after doctors and medical students with mental health problems, trying to address what is quite a tragedy in our profession, which is our high level of suicide.
It's really nice to see a shift in the focus, though, towards looking after our colleagues and their mental well-being.
I'd like to see more collaboration with allied health professionals in regional and remote areas. I think we have the opportunity for supporting each other in a better way. I just think we don't know maybe how to do it, and that each of us are feeling lots of the same pressures.
The more we keep talking about this, and the more that we really normalise and acknowledge how mental health is a part of all of us, and it can be easily, if we need to be treated, it can be treated. If we need to do some prevention work, it can be prevented as well. So it's having just that continued conversations and discussions around it as well.
It really is okay to seek help, and that it's understandable that it is harder to recognise in yourself than in others, but that you are worth of help, even if you don't feel worthy of help.
Our own health and wellness is so important. If we can't look after ourselves, we definitely cannot look after our patients.
We need to be making sure we're the best we can be for our patients.